Hi, this is Dr. Toby Moma, your host on Health and Wellness with Dr. Toby, inviting you to watch our show this week. Our guest is Shaterika Sampson. She's a professional licensed counselor at the Methodist Children's Home in Ruston. She's a member of the Assembly West Monroe. She's a Christian and she's a counselor. It's not every day you find a Christian counselor. And she's working with some of the most disadvantaged kids in our community: sex trafficking, bullying, children who have been abandoned, molested, and abused. She's talking about how she uses her psychological background. She has a psychology degree from the University of Louisiana Monroe, and she has a master's degree from Louisiana Technique. She's also pursuing her PhD right now with Walden University, and she's going to be sharing how she puts her Christian faith together with her psychology background to make a difference in this girl's and boys' lives. She's going to be sharing about her relationship. She's gotten married and how God kept her through that impurity. You don't want to miss it. Look forward to hearing from you. God bless you. Jesus is Lord. Hello, this is Dr. Toby, your host on Health and Wellness. It's a pleasure to have you on the show. Don't touch that dial. You will be blessed by this show this week. We have a special guest on the show. Her name is Shaterika Sampson. She's a licensed professional counselor, got her undergrad from the University of Louisiana Monroe, and then went on to have her master's at Louisiana Tech and currently enrolled in her doctorate in Walden University. And it's a pleasure to have her on the show. And she's going to be sharing insights from her experience. She currently works at the Methodist Children's Home and how we can improve the mental health status, especially around our children. Shaterika, you're welcome on the show.
Thank
Real
you.
pleasure having you.
Yes, sir.
Yeah, I remember she was with us at the Assembly West Monroe and always very enthusiastic and ready to help and see how God has raised her up. So when I met you, I think you were still in undergrad
Yes.
at ULM. That was, I think, the first time we met.
Hmm.
And you had just finished from Neville.
Yes.
So what inspired you to choose psychology? Was there was there a reason? Was there impulse? Was there some influence from the community, from your personal experience? What motivated you towards that area of profession?
There were multiple things that really influenced my decision to go into psychology, but the one that stands out the most in my mind was my senior year of high school. There was a news article about a young lady who had been sexually violated by an older brother. And come to find out, this young lady actually went to school with me, but had had multiple behavioral problems in school and was often suspended. And in that moment, the first thing I thought of was, is this why this child behaves this way? Is she not
Mm,
able to cope with all of this because we don't know what's going on prior to her getting to school?
wow.
And really, her story is what pushed me to wanting to get into psychology, specifically for those who have been sexually victimized.
So did she finish?
She finished high school.
Okay.
I have no record of knowing whether or not she went to college, but I do know that her brother was taken to court and went through the whole justice system, and he was arrested for what he had done to her.
Oh. Talk to my, so the audience out there is asking, how do you become a licensed professional counselor? What is the chart? What is the pathway? What are the milestones you have to cross? What are the boxes you have to tick off? I mean, what do I do in high school? What majors do I pick in high school? How
Yes.
do I get to where you are today? I don't think you mind me telling people, but she's only 27
Yes.
and she's already on the path to getting her doctorate in psychology. So Shatarika is a great example of a young lady who's pursued her purpose and accomplished her goals within a God-given time frame. So tell the audience watching what they can do to get to where you are today.
Yes, even starting off in high school, a lot of our high schools here in the Monroe and West Monroe areas offer dual enrollment courses. So you're actually able to start getting your college credits before you even step onto the college scene. And that was something I did. I was able to take a high school elective for college credit in psychology and in sociology, which led to when I got to college actually getting my bachelor's degree in psychology and then leading up into my master's program. You can take either two routes when you get to your master's program. The
Mm,
route that I took was in clinical mental health counseling, but we also see some clinical social workers who are taking that route as a master's program. And with that route, you're actually able to then get a job at a children's home, kind of like I do, or in any other type of agency, and do your 3,000 hours of supervised practice. And from there, you're able to apply through the Louisiana Board of Counselors or the Louisiana Clinical Mental Social Work, so that you can then apply for and obtain your license.
So is there an exam to take to get that license?
Yes, there is, and most people take this exam while they're in their graduate school program.
Okay.
But for counselors, it is the NCE, the National Counselors Examination.
Okay. So after your bachelor's, what are you eligible to do? Because there are people watching and they're like, oh, it takes too long. I don't want to spend 6 years in college and
Yes.
just to get my licensed professional counselor license. What can I do just outside my bachelor's? What can they do outside just a bachelor's degree in psychology?
What I've seen, most students who have their bachelor's but they're not yet through with, or they're going through their master's program, will do something as far as being a mental health specialist. We do have that position at the Louisiana Methodist Children's Home. And although you are not counseling, you are providing kind of that interim support and interim service to our clients in between the times that they're going to therapy. So you're more on the grounds, you're with the kids for at least 8 hours a day. You're working with them to get through any conflicts or any hurdles that they encounter while they're with you in that time. So more than anything, I think that that would be a great platform to really reassure that counseling is what you're wanting to pursue.
Did you have any inspirations or role models? I know your grandmother studied education or business?
She started in education.
Education
Yes, sir.
at Grambling State, am I correct?
She actually went to ULM.
She went to ULM,
Yes,
okay.
sir. And my grandfather actually went to Grambling State.
And then your parents
Yes.
went to...
My mom went to ULM.
Okay.
And my dad took more of a trade route.
Okay. So I'm wondering, are you the first counselor, psychologist in the family? Or
We
were
can-
there other people who had gone that path before you did?
We can loosely say that. I have an aunt that resides in Grand Prairie, Texas, and
Okay.
she actually has a background with having a psychology bachelor's degree, but instead of taking the counseling route, she took the special education route. So she works in the special education field in
In
Texas.
Texas, as a in the school industry.
Yes.
Wow. Okay. So a lot of people get confused, and you've got to help us here. So there's a lot of letters after this famous psychologist. You see Dr. Phil, and you see all those folks on TV.
Yes.
So can you explain to us the LPC, the LCSW, and then some people have the doctorate.
Yes.
I don't know if it's called PhD psychology or something.
Yes.
So what do those different titles allow you to do in the sphere of counseling and psychology?
Absolutely. So with an LPC, you are able to provide counseling services really to any demographic. It doesn't limit you to children or adults. You really can take any demographic that you would like. For the LCSW, that is a licensed clinical social worker. You're also able to do therapy and counseling through that credential. However, you're also able to work in fields like DCFS, because you do have a background of being able to work with families and setting up social services for them. As far as a PhD or a PsyD, that is, like you said, a doctorate program, and you're actually able to work in the academic setting if you're wanting to be a professor, if you're wanting to take more of a research approach and you want to research different methods or different approaches that could be worked with your populations. But you're also still able to continue in the counseling. More so than anything, the doctorate program kind of encapsulates everything.
Okay.
Yes.
Interesting. Because I have friends who go on and do the postdoctorate
Okay.
as well. They get a fellowship, a postdoctoral fellowship at the University of Mississippi where I work at. So it's always interesting because the question is, are they getting paid more? The more they learn, the more they study. I mean, do you guys charge Medicaid? Do you charge Blue Cross? Is there a fee that is dependent on your qualifications? For example, in your case, if you have a
With me
client
working
who's
with the Louisiana Methodist Children's Home, I'm more on a salary base. We have a
Right.
completely different department that really handles billing. But for instance, if I was in a private practice and I was having to bill insurance, insurance would pay, but then I would be able to take whatever percentage for that to be for the services that I personally rendered.
Interesting. Wow, wow, wow. So let's talk about your training. So give us an idea because I want to inspire some young girls out there, some young boys out there to pursue their dream. And some
Yes.
people are looking at you and they're like, I want to be Shatarika in 10 years. So give us an idea what courses, what hours, what number of weeks a year doing psychology took on you because you literally left bachelor's and went almost straight into the master's
Yes.
program.
Yes, sir.
Are there costs to that? I mean, financial costs? Are there
Mhm.
time you could have spent doing other things? Were you working a side job while working in school, while going to school?
I
So
was.
how did you handle all that? Because right now people are worried about student loans and stuff
Absolutely.
like that. So
Yes.
give us an idea your time in ULM and then your time in tech and how that shaped you into who you are today.
Absolutely. During my undergraduate program, I was working a typical retail job that most college kids would work. However, I was a full-time student, so I was taking at least 15 hours per semester. And that
And you
full,
were working at the assembly too, right?
yes,
Were
and I
you
was working in
were you
kids'
getting
church, but I was
paid a
having,
little bit?
no, I
No, you
wasn't. I was a volunteer.
weren't.
I was
You
volunteering
were a
time there.
volunteer, okay.
Yes, sir. Um, so with even making my class schedule in undergrad, I had to take my work schedule and see how I can make those two things compatible. So typically, I only have my classes on Monday, Wednesday, Fridays, and
Hmm.
on those evenings, I will work my part-time job and work those Tuesday, Thursdays I didn't have class, and then those weekends. So it was very busy. It did require a lot of late nights of staying up to read my assignments or to type up papers and get those assignments in. And even just thinking about the financial aspect of it, I was very blessed to be able to obtain TOPS. So that covered a great bit of my tuition at ULM.
Mm,
But there are some additional fees that come in, and those were covered by some of the federal aid that I was able to receive.
awesome.
And I also, again, had to use federal aid at Louisiana Tech when I was a student there. But luckily, for those of us who work in the counseling field, there are opportunities for loan forgiveness in the counseling field.
Mm,
Specifically, if you work at a nonprofit like the Louisiana Methodist Children's Home, if you're able to show 10 years worth of consistent work in a nonprofit setting, then a percentage of your student loans can be
can be
forgiven.
forgiven.
Yes, sir.
Okay, pretty awesome. Wow. So other than the work you did, and you didn't have any jobs in Ruston when you were there, or you?
Initially, I did not.
Okay.
Towards the second half of my master's program, I actually started working at the Louisiana Methodist Children's Home
Oh,
as a mental
okay.
health specialist.
Wow. Wow. Thank. So if I was to think of you in the medical field, so right now you work at a children's home. How does a psychologist fit in a hospital or clinic setting? What roles can they play?
More so, especially in the Louisiana Methodist Children's Home, you're taking more of an assessment approach and a diagnostic approach. As a LPC who has not yet obtained my doctorate, I do not have any right to make diagnoses for
Oh,
my
okay.
children. More than anything, I can make diagnostic impressions. This is what this is presenting as. This is what I believe it is. But we have a doctor on our campus who I can make a request to.
Mm.
Hey, these are my diagnostic impressions. Are you able to do a full assessment on this child?
And if you make a diagnostic impression, then what do you do after that to help that child? That's just my. What do you do after the
Yes.
diagnostic impression?
After the diagnostic impression,
Do you do like therapy? Do you do what else can you offer that child?
yes, therapy,
Okay.
absolutely. When our children make it onto campus, they are immediately placed with a primary therapist.
Mm.
And based from the history that we receive, from that history is where we initially start our treatment. But if we notice other diagnostic impressions that maybe would alter the approach of therapy we're taking, we would go ahead and make that difference or make that change.
And I know in the state of Louisiana, some psychologists can prescribe medications.
Yes,
It's a very confusing thing. Even I'm
it
a
is.
physician, and I can tell you, it kind of gets muddy a little bit. But
Yes.
most times, only physicians can write prescriptions. But what what does a psychologist need to have for him to be able to write a prescription?
If I'm not mistaken, and I might have to double
Hmm.
check this, I want to say there's either 6 or 9 hours of required pharmacology courses that a
Okay.
psychologist must take to be able to prescribe medications. But like you said, it's very muddy. So at
Yeah.
least at my job, we actually have psychiatrists who have actually already gone through medical school to do our
Right.
medication prescribing.
And it's different state by state. So
Yes.
you come to Mississippi, They don't write at all. So it's so different, you know. So tell us a bit about if I was to send Shaterika to the mission field in Afghanistan or Africa or Australia, how would you help the people of Kaura Namoda in Nigeria or the people, the Aborigines in, because it's for me it's hard to imagine you don't speak their language
Right.
and you're making a difference in their, so how would you make a difference in a polity, in a setting, in a community that is different from where you are?
Absolutely. One thing that I appreciate about psychology is understanding that there is no one norm. So
Mm,
that speaks to the different cultures that you reference, because what my norm is not this individual's norm. However, we all have things that cause us to hurt, and we have things that cause us to be traumatized. And I
mm,
think from that angle, understanding what this person perceives as hurt, what this person perceives as needed help, is the angle that I can come from. There's a particular therapeutic approach referred to as EMDR that actually stands for eye movement deprocessing or desensitization, excuse me, and reprocessing. And that particular therapeutic approach appears to be applicable in different cultures in different countries, because it takes more of a client-led approach than a therapist-led approach. So if I was given an opportunity to go to these different countries and these different cultures, EMDR would probably be my baseline of where to start.
mm. If you were to work in, if you were to start serving the people of Monroe, let's just juxtapose that Shaterika opened her office, and what would be your modus operandi to help the citizens of Louisiana, Monroe, especially West Monroe? I mean, what hurts do you think we can easily pick up among our community? What things make their lives more difficult? How would you approach a regular Monroe, Louisiana, West Monroe, Louisiana citizen to help them with their emotional hurts?
Hmm. That's a great one. So, to help the people of this area with emotional hurts, one of the first things I would do is one, build a rapport. I can't tell
Hmm.
you anything if I don't trust you.
Right.
So, to build that trust with that particular individual and then get them to a point where they're comfortable enough to share with me, as much as they're willing to share, what is it that hurts you? What is it that you want me to help you with? And
Hmm.
with that, as they're able to expose more, I'll be able to help more. And I do still think that EMDR would be very helpful as
Helpful.
well,
Okay.
because it does not require so much exposing or so much talking as traditional talk therapy would.
Mm.
It's more of a processing that happens within the mind that they're able just to translate over to me.
Because actually, I don't know if you know this, but the
Hmm.
Northeast Louisiana, where we are, has the highest childhood cancer rates in the
I
country.
did not know that. Wow.
And then we have one of the highest childhood syphilis rates in the country.
Wow.
So there's some demographics that point to a devastating effect of sickness in this area.
Absolutely.
Yeah, so it's something that I've always thought about. At people here go through quite a few hurts, so that's
Absolutely.
why you see a lot of people going to St. Jude or
Hmm.
Shreveport or flying to MD Anderson. There's
Yes.
a disproportionate number of cancers in the area,
Wow.
you know. So let's talk about your. We're going to talk about your family later on, but you
Hmm.
you had a challenge a few years ago. Your brother
Yes.
had, I think it was nephrotic syndrome. Am I correct?
It was the C3, the
Okay.
complex component. It was so many words,
Right.
but it was an
Okay.
autoimmune deficiency issue that he was having.
So obviously you were in college then.
Yes.
Okay. You didn't get to apply your training on him, I'm sure.
No, I didn't.
And
And
on your mom and dad, because that was a traumatic
it was.
experience,
And
you
it was a
know.
very long and trying time for the
It
family.
was 5 years ago.
Yes, sir.
Okay. I don't know if you want to share it on public TV what
Yes,
happened.
I,
Yeah.
I don't mind.
Okay.
Honestly, before we even knew that he was ill, my mom was very concerned because she had a reoccurring dream of her writing his obituary. And so she went on a fast and began praying and just asking God to reveal, why am I writing my son's obituary? He seems perfectly healthy.
And that was that particular son, not your other brother.
No,
That
sir,
particular
that
son.
particular son.
Wow.
And as she began to pray, he was around 19 at the time, and He went to the doctor for a regular checkup, and they noticed that his blood pressure was extremely high, and they were unable to pinpoint what was causing it. But that was the red flag that pointed to some difficulties with his kidneys. And he also was in college at the time, so he was struggling a lot as well, with having to go to and from Shreveport and to and from Tennessee at Vanderbilt, having to try to work with his teachers, asking them to reschedule assignments around him needing to do dialysis and things like that. But it got to the point to where his treatment team decided that he needs a kidney transplant. And they discussed the likelihood or the lack of a likelihood that he would find a match. But luckily, we were blessed that not only was my mother a match for him, but my youngest brother was as well. So he actually had a picking of what kidney he would use for the transplant. So thankfully, we were actually able to schedule the transplant a month after he graduated college.
Wow.
Yes.
praise God.
And so he was out of school. My mom was out of school for the summer, given that she was still in education. And the summer of 2018, they went ahead and had the kidney transplant. And both of them are doing extremely well. Both of them are
And
healthy.
it's important that you understand that kidneys are not picked on the market. They're, I mean, they're very valuable products. We have about 25 million Americans who need some form of kidney transplant.
Wow.
That's a lot of people.
Yes.
5 to 25 million, but out of that, less than 200,000 get a kidney.
That's so sad.
So when I heard the story, because we prayed and we, we believed for your brother's healing, and that was just a God thing.
Yes,
To
absolutely.
make your mother and brother compatible for his match that's a God thing.
Absolutely.
But why I'm saying this is because at times what you study, you have to practically implement, right?
Yes.
Because I'm sure you had to learn all those. What are those? Can you help my audience with those techniques you guys use in
Yes.
psychology, like not the inhalation, but there's
Like the deep breathing and the coping skills and
yeah,
all
and
of
all
that.
that,
Yes.
the interview techniques,
Yes.
all that stuff. Those things come in useful when you find
Absolutely.
yourself in a difficult fix like your brother did.
Yes,
So
sir.
that's pretty awesome. So how is he doing right now?
He's doing very well. He's actually working in Ruston, Louisiana as well. He got his degree in risk management insurance, and he's working in that field with a mortgage
Awesome.
company. Yes, sir.
Interesting. Okay. I haven't heard anything about marriage, so I guess he's not.
Not yet. I'm the only one with wedding bells right now out of the three of us.
So right now, the most popular, and I don't know if you agree with me, but the most popular pathway for psychologists in America is marital counseling. I don't know why. I guess Dr. Phil and Co. have made it popular. So
Maybe.
most people, you talk about counselors, professional counselors, they think, oh, are you having a marital problem? Are you having some issues with your family? So what does a psychologist do in the area of marital counseling? If I bring a woman and her husband here, or I bring a child and his parents, how do you, I mean, tell me what you will do. I'm sure you do that a lot at this Ruston.
More so with the children and their parents,
Right.
not so much with the marital
Okay.
setup, but I'll even come from the angle with the parent and the children. The first thing to do is to definitely get on that parent side, not pairing up against the child, but reaffirming the parent that I understand this is your child, you're the expert in their lives. Can you at least start off with telling me what some of the issues are? What have you already tried to implement? What is your biggest complaint? And then still giving the child a platform to do that as well. So we attempt to foster an environment that is both respectable as well as open, allowing the child to feel safe, allowing the child to feel that their voice is heard. Because I'm learning in a lot of family dynamics that children's voices are not really heard, not really accepted. They're more to be seen than heard. So allowing the parents to understand that they're not relinquishing their power by allowing their child to speak, they're giving their child a safe place to build a healthier relationship with them.
So how many, because in my university, every time a psychologist sees a patient, it's like an hour.
Yes.
So you guys always spend an hour?
Yes, sir.
Is that normal? Is that, I mean, you can't do a 30-minute session or?
It is normal. Now, with the Children's Home being a psychiatric residential treatment facility, we do have some stipulations and some rules and regulations that may not apply to maybe a private practice. Typically, in a private practice, you may see a client for an hour every week. However, in the PRTF setting, I'm seeing a client for 120 minutes or 2 hours a week every single week that they're there.
Okay, wow. That's a lot of talking.
It is a lot of
Do you
talking.
write when they're talking?
Depending on the child, if I have a child that easily gets distracted or my
Right.
writing freaks them out and they're worrying, what are you writing down? Why are you writing that down? I
Yeah.
don't. But typically at the end of my session, maybe the last 5 minutes, I'll actually type my note and allow the child to read it so that they can give their input and agree or disagree
Uh,
with the documentation of what we worked on in session that day.
wow. We're going to talk about what Chiterica does at the Methodist Children's Home when we come back, because it's a phenomenal facility. They have branches all across the state of
They do.
Louisiana, and they've been doing this for 30 years, maybe or more.
More than that, we
Uh,
opened in 1902.
so
Yes.
120, almost 120 years. So I
Mhm.
want to learn what they do, because I think some of you may not be aware of the facilities and what they offer. And she's going to just share her point, what she does at that facility, and how maybe you can be a support to that facility and what they're offering. So again, this is Dr. Toby Moma with Shatarika Sampson, a licensed professional counselor, sharing with you that Jesus can heal your broken heart.
Yes.
He said in Luke 14 that the Spirit of the Lord is upon me because he has anointed me to preach the gospel to the poor, to heal the brokenhearted, to set at liberty them that are bruised, to preach deliverance to the captives, and to declare the acceptable year of the Lord's favor. That's why Jesus came, to heal your broken heart, to set at liberty those who are bruised. If you are hurting, there is a solution. Jesus can be the solution to the hurt that you're facing. I'm talking to people who are facing matrimonial, family, employment dynamics, and they're hurting and they don't think they can get any solution. People like Shaterika can offer a solution. God has given her information, knowledge that can be a blessing to you. Take advantage of it. We're going to put her contact address on the screen. We want you to get in touch with them, and she can direct you with how you can get help. We can reach me at faithandpower.online. My P.O. Box is P.O. Box 550 71294, West Monroe, Louisiana. Write to us. I actually have a material I want you to get if you are in the area. If you can order it online, it's called The Death Knell Called Depression. So this book was written a couple of years ago, but it targets depression and it explains to you the dangers of the depression. Why depression has a death knell. It doesn't look bad initially, but if you don't take care of it at the onset, it can spiral out of control. You want to get a copy, just go to my website, faithandpower.online, and then join us anytime you're available. We're in the area every last Friday of the month. We have our Holy Ghost night in Monroe at it's now called the Oyo Hotel on 165. We do it every last Friday from 11 p.m. to 4 a.m. We were there last night. We're going to be there March 27, 2020. It's 11 p.m. We're going to be sharing on the spirit of liberty. You don't want to miss it. Look forward to seeing you. God bless you. Join us next week for a continuation of this discussion with Shatarika Sampson. God bless you. Jesus is Lord. Amen.